I welcome you all to the second edition of anatomy quiz for for ATBU medical students, sponsored by our teacher, Dr. Dauda Abdullahi, or Mr. Dauda Abdullahi, who is currently pursuing his PhD in London. So, without any further ado, I am Abdurrahman Ahmad Abdullahi. I'm going to be your host for this particular quiz, and we have some invited guests that have joined us, and some that are on their way. They have not yet joined us. So I hope all the 10 participants are around. We are going to do a roll call very soon, and then before then, I would like to start by introducing or saying something about Dr. Dauda Abdullahi, who is the sponsor of this quiz. All right. So it is my pleasure to introduce a man whose brilliance, dedication, and passion for anatomy continue to inspire students. Mr. Dauda holds a Bachelor of Science in Human Anatomy from the University of Maiduguri, where his journey into the fascinating world of anatomy started. Driven by an unrelenting desire for excellence, he proceeded to Malaysia, where he obtained his Master of Medical Sciences with distinction. And this is just a reflection of his academic depth and commitment to mastery. Yeah. Currently, he is pursuing a PhD in neuroimaging in the Institute of Psychology, Psychiatry, and Neuroscience, King's College London, one of the world's most prestigious research institutes. His work bridges the realm of anatomy, neuroscience, and mental health, exploring how the human brain shapes thoughts, and emotions. And beyond the academic achievements, Mr. Dauda has made several publications in reputable journals and earned numerous citations, underscoring his growing impact in the field. Yet perhaps what stands out most is not just his intellect, but his approachable teaching style, deep enthusiasm, and ability to make anatomy come alive for his students. Ladies and gentlemen, please join me in appreciating a scholar, a mentor, and an inspiration to many, Mr. Dauda Abdullahi, who is unfortunately not around because he's busy with some of his research works. Our guest of honor is unavoidably absent, as I've mentioned earlier. However, we are going to hear about him when he joins later. So the second guest of honor is not really a guest per se. He is our very own Turaki, Dr. Abdulmumin Ibrahim Turaking Adbunsa, who graduated from this institution as part of the second set. He is presently in the second half of his housemanship in Azari. I'm glad to have served you as a deputy, sir, and we are very honored by your presence. So please, sir, if we would like you to give us a welcome remark of 2 to 3 minutes. Thank you, sir. Dr. Abdul Mumin. Sorry, Dr. Abdul Mumin is having difficulty connecting. So let's see what can be done. All right. So as before Dr. Abdulmumin joins, I would like to call on some of the members of the quiz team, the people that are organizing the quiz. So I would like to start by calling on to Alamin Usman, who is going to give us a roll call for the participants and make sure everyone is on ground. Alamin, please, are you close? Alamin
Yes, I'm
Usman.
close,
Alamin.
sir. Good morning. Yes, I'm present. Good morning.
Good morning, sir.
Is there anything I should say, or is just my presence?
Yes, we want you to introduce yourself and then give us a roll call of the participants and their numbers.
Okay. Good morning, everyone. As earlier introduced, my name is Alamin Usman, and I will do the roll call for the participant that will participate in this Nobel quiz. God willing. So starting from the first participant. So the first participant is Abdullahi Ishak Magaji. Abdullahi Ishak Magaji, are you present? Please, if you are present, unmute your mic and then indicate.
Okay, I am present, sir.
Okay,
All right,
Abdullahi Ishak
so
Magaji.
yes,
Thank you.
that's participant number 1.
Yes, that's participant number 1. And then the next participant is Aliu Hindu. Aliu Hindu, are you present, please? Aliu Hindu.
Yes, I am.
Okay, so Aliu Hindu is also present here with us. And then that's participant number 2. And then the next participant is Atayobi Oladura Israel. Atayobi Israel, are you here with us?
I'm present. Yes, I'm present, sir.
Okay. So Atayobi is also
So
present.
please, guys, you need to be taking notes. You are participant number 1. Aliu Ishaq is participant number 1. Participant number 2 is Aliu Hindu, like that. So please remember, you're not going to be just saying participant number 1, participant number 2 during the quiz. Please note your number.
Okay. Then the next participant, which is participant number 4, is Mohammed Tahir Yahya. Mohammed Tahir Yahya, are you present?
Present.
Yes. So
Present.
you are participant number 4. Henceforth, you'll be regarded as such. Then the next is that's the participant number 5 is Muhammad Saidu Abdullahi. Muhammad Saidu Abdullahi. Muhammad Saidu Abdullahi.
Yes, sir, I am present.
Okay, so Muhammad Saidu Abdullahi, hope
I
you
am
know
present,
your
sir.
participant. Your participant number what?
5.
Muhammad Saidu Abdullahi. You are participant number 5. Exactly, that's okay. So the next participant is Musa Mustafa Garkwa.
Present.
So Musa Mustafa Garkwa, you are
5.
participant number 2. Okay, and then you'll be regarded as such henceforth. Then the next participant is Olojede Oladeyo Timothy.
Present.
Olojede Oladeyo Timothy. You are participant number what?
Number 7.
Number 7. Thank you. Then the next participant is Sule Daniel.
Present,
Sule
sir.
Daniel. You are
I'm here,
participant number
sir.
what?
Number 8.
Participant number 8. Thank you. Then the next participant is Sunday Omeke.
Present.
You are participant number what?
9.
Participant number 9, exactly. So the next participant, which is the last one, is Williams Ayodele Segun. Williams Ayodele.
Present, sir.
So you are participant number 10. So please, to all of the participants, please hold to your numbers very tightly and then be conscious of the time. Be conscious of who is before you and who is after you. So that during the quiz, we'll not be calling your name multiple times or we'll be calling your numbers because henceforth we'll be regarding you as these numbers to save time, okay? So thank you very much for being here with us and I wish you all the best. Thank you very much. So Quiz Master, over to you. Thank you very much.
All right, thank you very much, Alamin Usman, who is the deputy organizer of this quiz. The next person I would like to introduce himself is Aliu Abdullahi, who is going to be our scorekeeper. So, Mr. Aliu Abdullahi, if you're around.
Thank you very much. Good morning, everyone. I'm Ali Abdullahi, a final year medical student from this prestigious University of Abu Bakr Tafawa Balewa University. And I will be here with you throughout the quiz, inshallah, and I will be the scorekeeper. Thank you very much. I hope you will enjoy the quiz and wish you success. Thank you.
Thank you, sir. The next person is Ahmad Attahir, who is going to be our timekeeper for the quiz. Ahmad Attahir, can you please introduce yourself?
Good morning, all. I am Ahmad Attahir, and I am going to be the timekeeper throughout this quiz. So I wish you all the very best. Thank you.
Thank you very much, sir. The next person I would like to call on is Amir Yusuf Sani. Amir, please, are you with us? All right, I think Amir is busy. He was called in anesthesia, so he will be joining us later. So without any further ado, we are just going to dive into the quiz until our guests have joined us, and then we'll give them some ground to say something. So I think Abdul Mumin have joined. Let me check. Unfortunately, I cannot find his contact. I don't think Dr. Abdul Mumin have joined. Amir Yusuf Sani, I can see you. Please, can you hear us? All right, I think Dr. Abdul Mumin is around. Okay, so good morning, sir. He is the second guest of honor. He's our former president of Adbumsa, who graduated from this institution as part of the second set, presently in the second half of his housemanship in Azari. I'm glad to have served you as a deputy, and we are very honored to have you by your presence, sir. So, sir, please, can you give us a few minutes of welcome remark and also introduce yourself, sir?
Okay. Good morning, everyone. Good morning, sir. Good morning, the moderator and all the quiz participants. My name is Dr. Abdullahi Ibrahim, as introduced by the quiz moderator, in person of soon to be a Dr. Abrahman Ahmad Abdullahi. I'm happy to be part of this program today, and as he earlier told me that this quiz is sponsored at 100% by one of our great anatomists, our lecturer, whom invested a lot on us, and we have taken the knowledge impacted on us to the world, saving lives of people with. I commend the moderator and also thank the sponsor of this quiz program, and I encourage all the participants to take this avenue as a learning avenue, to give them their best and open their mind to learn one or two things that they might come across, not because they don't know, but this is another avenue for them to learn and relearn what it is about anatomy and everything. I wish you best of luck, and I wish you success, and I hope you have a very interesting session. Thank you very much, and I thank you all.
Thank you very much, sir. That is Dr. Abdul Mumin Ibrahim, striking at Bumsa, one of the pioneers of at Bumsa, and also one of the people that shaped it the most. At Bumsa is still on its track to being a great MSA, thanks to the efforts of Dr. Abdul Mumin and his predecessor. Thank you very much, sir. We are really honored by your presence. We are grateful that you could find time out of your busy schedule to be here with us. So I think that suffices. So I hope you can see my screen. Ahmad Attahir, please, is my screen visible?
Yes, sir, your screen is visible.
Yes,
right.
we
So
can
thank you very
see
much.
your screen.
All right, thank you very much. So
Anadia,
there is going to be, I'm going to quickly recap some of the rules for the contestants. Number one, your mics and videos must be on from when the participant chooses a question until the answer is verified. You have to be on camera and your mic have to be on. So try to avoid noisy environments so that you'll be able to hear the question. Number two, contestants must avoid noisy place. Well, that's easy. And then the third one is any evidence of cheating could lead to disqualification. We have a number of people that are just here to observe and see if there is any misbehavior and then report it. And then the last thing is the quizmaster's decision is final. Sometimes, there is a lot of variation when it comes to knowledge, especially anatomy. Some people think this, some people think that. So we cannot all be, arguing which one is right, which one is wrong in this kind of situation. We can sort of try to sort it out, of course, but if it's proven to be difficult, we'll just have to go with whatever decision was made. So thank you. So this is the list of the people, the quiz committee or the quiz coordinators. All right. So this quiz is going to be in 2 rounds. The first round, 10 participants are going to contest against each other. And then we are going to eliminate the first 4 people are going to be eliminated, and 6 people will make it into round 2, which is the final round. And then there we are going to have the 6 people compete against each other for the first place down to the 5th place. And also the result of this quiz is going to be cumulative. So your score in round 1 is going to reflect in your final score. All right. And then Sunday Omeke, please can you mute your mic? Yeah, thank you. And then all questions carry equal mark. Questions that have options are going to be given only 10 seconds for the participant to attempt, while questions that have no options or images are going to be given 15 seconds. I'm sure the timekeeper is going to do justice to that. So without further ado, we are going to start. This is round 1 of the second edition of anatomy quiz for ATBU medical students, sponsored by Dr. Dauda Abdullahi. So I would like to start by calling on to the first participant. Participant number 1, please choose a question.
Okay, sir. I choose question number 4.
Question number 4. Question number 4 says, which of the following nerves does not directly arise from the root of the brachial plexus? A, nerve to subclavius. B, the long thoracic nerve of the bell. C, the dorsal scapular nerve. And D, the phrenic nerve. You have 10 seconds.
A,
Your time
nerve,
starts. That
A,
is
nerve
correct.
to subclavius.
That is correct. Nerve to subclavius does not originate from the root of the brachial plexus. It actually arises from the upper trunk of the brachial plexus, from the lower aspect of the upper trunk. That's 5 points for participant number 1. Participant number 2, please choose a question.
Question 2.
Question number 2. Question number 2 says, which of the following is not a superficial branch of the femoral artery? A, superficial epigastric artery. B, superficial femoral artery. C, superficial circumflex iliac artery. And D, superficial external pudendal artery. You have 10 seconds.
B.
That is correct. The superficial femoral artery is actually considered by some people to be just the femoral artery after it gives rise to the profunda femoris artery. So that's correct. 5 points to participant number 2. Participant number 3, please choose a question. Question 7. Participant number 3, please can you be on your camera? You are a little bit in a dark place. All right, so you say question number what?
7, sir.
All right. Question number 7. This is a photomicrograph of a tissue in the body. So identify it. A, is it a skeletal muscle? B, is it cardiac muscle? C, is it smooth muscle? And D, is it embryonal tumor? You have 10 seconds.
Skeletal muscle. A.
A, skeletal muscle. Hello?
Yes, sir. Yes, sir. Skeletal muscle, sir.
Unfortunately, that is wrong. The correct answer is cardiac muscle. Sorry, participant number 3, but it's all right. Don't be discouraged yet. There is a lot more to this quiz. You can see that the fibers are branching and there is presence of these intercalated discs and they are multinucleated. So these are characteristic features of cardiac muscles. Skeletal muscles They are also multinucleated. However, they are not having branches and they do not have intercalated discs. All right. So participant number 4, choose a question.
Question 8.
Question number 8.
Question 8.
Question number 8 says the tendon of long head of bicep is A, extracapsular extrasynovial, B, intracapsular intrasynovial, C, extracapsular intrasynovial, D, intracapsular extrasynovial. You have 10 seconds.
D.
D, that is correct. The tendon of long head of biceps is intracapsular but extrasynovial. It is within the capsule, the joint capsule of the shoulder joint, but it is outside the synovial membrane. So that's 5 points for participant number 4. All right. So participant number 5, choose a question. Participant number 5.
Question number 10.
All right, question number 10. Are you on your camera? Please, can you zoom out so that we can see you clearly? Thank you. Question number 10 says, which of the following is not a component of the coracohumeral arch? A, the coracoid process, B, the coracoclavicular ligaments, C, the coracoacromial ligaments, D, the acromion process. You have 10 seconds.
D.
D, the acromion process.
Time up.
Unfortunately, that is wrong. The correct answer is B, the coracoclavicular ligaments. The coracoacromial arch is this continuous arch formed by the coracoid process, the coracoacromial ligaments, and the acromion process. It prevents the upward displacement of the shoulder. So it's the coracoclavicular ligaments that do not form part of the arch. So 0 points for participant number 5. Participant number 6, choose a question.
Question 1.
Question number 1, that's bold. A potential space in the distal forearm, that is the volar aspect of the wrist, that lies deep to the flexor tendons is called. A potential space in the distal forearm that lies deep to the flexor tendons is called A, Guyon's space, B, space of dis, C, space of Parona, and D, volar space.
Space of Parona. C.
That's correct. 5 points to participant number 6. Space of Parona is actually the space that is, it's a potential space in the distal forearm. Sometimes infection from the thenar space and mid-palmar space can track down and get there. So 5 points for participant number 6.
Okay, sir.
Participant number 7.
Before we proceed, sir, can you
Yes,
hear
sir.
me? Participant
Yes,
number
sir.
6. Next time, be on camera, please. We didn't see you the last time.
Okay. Participant number 6, this is going to be your last warning. Otherwise, you are going to lose your points. This is going to be your last warning. I will assume that this was a mistake. So please do not only you, nobody should even make this mistake again. Thank you, Ahmad Attahir, for this observation. Thank you, Alamin, also for making the same observation. So participant number 7. Participant number 7, choose a question.
Okay, question.
What did you say? You are not audible, participant number 7.
Question 5.
All right, question number 5. Question number 5 says the transpyloric plane of the abdomen, that plane that passes through the lower border of L1 vertebra, passes through A, the spleen, B, the third part of the duodenum, C, the tail of the pancreas, and D, the origin of the superior mesenteric artery.
The origin of the...
All right, you say?
D.
All right, so that is correct. 5 points to participant number 7. The transpyloric plane passes through a lot of structures. However, the hilum of the spleen is a little bit higher off. So you have 5 points. 5 points to participant number 7. Participant number 8, choose a question.
Okay, question number 13.
Question number 13. Question number
Can
13
you see?
says proximal injuries. Proximal injuries to nerves are generally more debilitating than distal injuries. But in the case of the ulnar nerve, injuries proximal to the elbow produce less clawing compared to injuries distal to the joint. What term is used to denote this concept? You have 15 seconds.
Ulnar nerve paradox.
That's correct. 5 points to participant number 8. It's surprising. I thought people are going to find it difficult to answer this question, but surprisingly, you got it on the first attempt. 5 points to participant number 8. Participant number 8. Participant number 9, choose a question.
3.
Okay, question number 3. Question number 3 says a midline episiotomy used to be a common procedure done by obstetricians to avoid unpredictable perineal lacerations in difficult deliveries. To reduce the risk of pelvic prolapse, episiotomies are no longer made on the midline to avoid cutting an important piece of connective tissue called, you have 15 seconds.
Oh.
Time up.
Sorry, participant number 9. I think the question was a little bit not very straightforward. The answer is actually the perineal body. So if you look at the question, people used to cut directly from behind the vagina through the midline, and then they go through the perineal body. But this perineal body is a very important piece of connective tissue that anchor a lot of things in the pelvic floor. So when you injure it and it doesn't heal well, there is a risk of pelvic prolapse. So now they avoid and go away from the midline. All right. So 0 points for participant number 9. Don't be discouraged. This is just the beginning. Participant number 10, choose a question.
Question 16.
Question 15 or 16?
Question 16. 1-5.
All right. Question number 15. It says, which of the following structures does not enter the inguinal canal through the deep inguinal ring? A, the testicular artery. B, the vas deferens. C, the ilioinguinal nerve. And D, the genital branch of the genitofemoral nerve. You have 10 seconds.
Ilioinguinal nerve. Question 6.
The ilioinguinal nerve. That is correct. The ilioinguinal nerve does not pass through the deep ring. It actually passes through the the external oblique muscle and then enter into the inguinal canal. It is a content of the inguinal canal. However, it doesn't pass through the deep ring. So that's 5 points for participant number 10. All right. So we have rotated. All participants have attempted a question. So we are going for the second round of questions. Participant number 1, choose a question.
Okay, question number 15. Okay, has been answered. Question 20.
Question number 20. Question number 20 says, what is the nerve root? What is the root value of the iliohypogastric nerve? A, L1 and L2. B, L1, L2 and L3. C, L2 and L3. And D, T12 and L1. You have 10 seconds.
D.
That is correct. The iliohypogastric nerve is a branch of the lumbar plexus. It is formed by the navi furcalis. Well, no, not the navi furcalis. It's formed by union of the fibers from T12 and L1. So that's 5 points for participant number 1. Participant number 2, choose a question.
Question 21.
Question 21. It says the deep perineal space is deep to the perineal membrane. It contains A, membranous urethra. B, the vagina. C, deep transverse perineal muscle. And D, all of the above. You have 10 seconds.
A. Membranous urethra.
Time up.
I said it. A. Membranous urethra. I've already answered.
All right, sorry, that's wrong. The answer is all of the above. The deep perineal space contains the membranous urethra, the vagina, part of the vagina, and also the deep transverse perineal muscle. So don't be discouraged. We have more questions to attempt. Participant number 3. Party.
Kai wannan yake fitowa yanzu yana wani ɗaki kyakkyawa yanzu ya shigo kasuwa.
Ahmad Attari, on YouTube. Participant number 3.
Question number 12, sir.
Question number 12. All right. So it says all the following is true about dorsal root ganglia, except they are A. Sensory, B. Motor, C. Containing pseudounipolar neurons, D. Located in the intervertebral foramina.
Motor.
You say?
Time up.
Participant number 3, you said what?
Time up.
Okay, I heard you speak. Just calm down and say what you were saying. What did you say?
I said B, motor. B.
Okay, that is correct. 5 points to participant number 3. I think I saw him speak, and I think he said moto, but I wanted him to confirm, so that's why the time elapsed. Okay, 5 points for participant number 3. Participant number 4, choose a question.
Question 50.
You said?
Question 50.
Question number 50. That's boring. It says the testicular blood supply. Which of the following is true regarding the testicular blood supply? A. Mainly from the ductal artery. B. The right drains directly into the inferior cava. C. Venous drainage does not have valves. D. A varicocele is more common on the right than the left. You have 10 seconds.
D.
D. A varicocele is more common on the right than left. Unfortunately, that is wrong. The correct answer is right drains directly into the inferior cava, because the hydrocele are actually more common on the left side because of the drainage of the left testicular vein into the renal vein before going to the inferior cava. So that's 0 point for participant number 4. Participant number 5, choose a question. Participant number 4, please mute your mic. Thank you. All right, participant number
31.
You say participant number 5.
31.
Please, can you zoom out so that we can see your face?
Question number 31.
31. It says injury to which nerve is mainly implicated in foot drop? You have 15 seconds.
Common peroneal nerve.
Well, that is correct. Common peroneal nerve as well as the deep peroneal nerve can both be implicated in foot drop. So 5 points for participant number 5. Participant number 6, choose a question.
58.
Number 58. It says, which of the following is true regarding the intercostal nerves? A. It arises from the posterior rami of the thoracic spinal nerves. B. It lies inferior to the intercostal arteries. C. It runs between the external and internal muscle layers. And D. Have no cutaneous branch. No cutaneous branches.
B. It lies inferior to the intercostal artery, but not directly.
Yeah, that is correct. Well, it's actually quite directly, the arrangement, vein, artery, then nerve. So 5 points to participant number 6.
Okay.
All right. So participant number 7, choose a question.
Question number 23.
Question number 23. A fluid-filled sac that forms in the popliteal fossa, seen in degenerative or other joint diseases, is called. You have 15 seconds.
Bursitis.
Unfortunately, that is wrong. The correct answer is Baker's cyst. Baker's cyst occurs usually is this. Bursitis, there is inflammation, there is fluid accumulation. However, it's actually referring to the Baker's cyst. That's where it happens when there is degenerative disease, like osteoarthritis and what have you. So 0 points for participant number. Is it 7? Participant number 7. So participant number 8, choose
Question number 11. Hello, can you hear me?
You say question number 11?
Yes, sir.
All right. Participant number 8 chooses question number 11. It says the Trendelenburg gate can be a repercussion of injury to which of the following? A, the superior gluteal nerve. B, the inferior gluteal nerve. C, L4, L5, and L6 spinal nerves. D, sciatic nerve.
A, superior gluteal nerve.
That is correct. 5 points to participant number 8. Participant number 9, choose a question.
9.
You choose question number 9. All right. Question number 9 says the bulb of the penis is located in the D, deep perineal pouch. B, superficial perineal pouch. C, ischiorectal fossa. And D, none of the above. You have 10 seconds.
A,
deep perineal pouch. Unfortunately, that is wrong. It is supposed to be in the superficial perineal pouch. 0.
Question 6. Question number 6.
Sorry, guys. I had a bit of a technical glitch. So I'm going to continue sharing my screen. Can you hear me, please?
Yes, sir.
Yes, sir, we can hear you.
Thank you very much. So participant number 10, choose a question, please.
Question number 6.
Question number 6. Question number 6 says, I'm coming, please. The layer in the epidermis which contains keratohyalin granules is A, stratum spinosum, B, stratum basale, C, stratum lucidum, and D, stratum granulosum. You have 10 seconds.
Stratum granulosum.
That is correct. From the name granulosum, contains the keratohyalin granules. So 5 points for participant number 10. So we have completed 2 rounds of questions so far. Before continuing, I have noticed the presence of one of the guests of the guest of honor, basically, in person of Dr. Dauda. So I will start by giving him a brief introduction, and then he will give us a speech, basically. Dr. Dauda E. Suleiman is it is an absolute honor to introduce a man whose excellence, discipline, and humility continues to set ground, to set the standard for what it means to be a true mentor. Dr. Dauda is an honorary consultant histopathologist, renowned for his meticulous attention to detail, his deep sense of responsibility, and his unmatched punctuality and organization. Personally, I've never seen a person more organized and more punctual than Dr. Dauda. Today, probably there was a problem with communication. Maybe I miscommunicated. It's most likely a defect from my side. not communicated with him maybe as much as I should. He is a man of strength, simple but complicated in a way. A proud alumnus of Ahmadu Bello University, Zaria, Dr. Dauda graduated as the best graduating medical student of his set. One of our consultants actually told us a story about him. Whenever you want a tutorial, you just go and meet Dr. Dauda, give him the topic and the venue, that's all. Whenever it is you want it, he's going to show up and everyone is going to probably have the lecture of their lives. He is a fellow of the National Postgraduate Medical College of Nigeria and a member of the West African College of Physicians. These are credentials that reflect his professional excellence and commitment to continuous learning. His research interests lie in cancer biology and epidemiology, with particular focus on childhood eye cancers in Nigeria, where he contributes to make meaningful contributions, continues to make meaningful contributions to the fight against cancer and the advancement of medical science. But beyond his impressive qualifications and research, what truly defines Dr. Dauda is his dedication to his students. He is always approachable, always willing to listen, and always ready to help. That's something that you do not see very common among teachers. It's something special to people like Dr. Dauda. Ladies and gentlemen, please join me in welcoming a man of science, service, and sincerity, Dr. Dauda E. Suleiman. You are welcome, sir. We would like to hear your voice, sir. Thank you very much.
Thank you very much, Abdurrahman, for this very glowing introduction. First of all, I want to apologize for joining late. So it wasn't your mistake. I had some issues with my data, so I couldn't connect earlier. So I'm happy that you have started the program, and from what I've heard so far, it seems to be going well. It's always a delight to see that medical students are always keen to engage themselves in this kind of cerebral exercise, which has always been part and parcel of the culture of medical school over the years. And I'm very glad that you are trying to keep this culture up, this tradition of trying to engage ourselves intellectually. I also want to especially appreciate the sponsor of this program, Dauda Abdullahi, who has really shown his support for academic excellence by encouraging students to engage in this exercise and also making funds available for the conduct of this exercise, as well as the prize monies that will be awarded to deserving winners at the end of the day. So I don't want to take too much of your time. I'm just here to enjoy and watch this event unfold. So thank you very much for having me.
Thank you very much, sir. We are very grateful and glad to have you. Thank you very much, sir. All right, so without further ado, we are going to continue. Participant number 1, this is another set. This is the third set of questions. Participant number 1, choose a question.
Number 18.
Number 18. I'm coming. Question number 18. It says, which of the following is not considered a usual branch of the anterior division of the internal iliac artery? A, the internal pudendal artery, B, the iliolumbar artery, C, the obturator artery, and D, the umbilical artery. You have 10 seconds.
Obturator artery, C.
All right. Unfortunately, that is wrong. It's actually the iliolumbar artery that is not a branch of the anterior division. The internal iliac artery. All right. So 0 points to participant number 1. Participant number 2. Well, sorry, please. Participant number 2. Before you choose a question, I'm coming. Participant number 1. Which question did you choose again? Question number 18, right? I think there is something wrong with this question. The anterior division of the internal iliac artery gives rise to about 8 branches. It's the posterior division that gives rise to the iliolumbar artery, the lateral sacral artery, and the superior gluteal artery.
Okay.
The anterior division actually gives rise to the obturator artery. So which of the following is not a branch of the anterior division? All right, so it's still wrong. Sorry, I understand. I was confused a bit. Participant number 2, choose a question.
Question 22.
Okay, question number 22 says, what is the principal content of the Guyon's canal? You have 15 seconds. The principal content of the Guyon's canal.
The ulnar nerve.
That is correct. 5 points to participant number 2. The ulnar nerve is the principal content of the Guyon's canal. So participant number 3, choose a question.
Question 24.
Question number 24. It says, all the following are found in the epidermis, except all the following are found in the epidermis, except A, keratinocytes, B, Pacinian corpuscles, C, Langerhans cells, and D, melanocytes. You have 10 seconds.
Okay. Pacinian corpuscles.
That is correct. Pacinian corpuscles are actually mechanoreceptors that are situated deep in the dermis. They are responsible for sensation of pressure and vibration, and they are very rapidly adapting receptors. So once you put a pressure on an area, over an area for a sustained duration of time, it's going to become numb. So 5 points to participant number 3. Participant number 4.
Question 14.
Question number 14. Is dense vertically oriented bones of bone tissue that originates in the posteromedial portion of the femoral shaft under the lesser trochanter and are responsible for bearing compression load and stress redistribution is called, or they are called, A, the calca avis, B, calca femoral, C, retinacular grooves, and D, subiculum. You have 10 seconds.
A.
A, calca avis.
A.
Unfortunately, that is wrong. The answer is calca femoral. They are these dense tissue that pass through the neck of the femur to support the weight of the body. 0 points for participant number 4. Participant number 5, choose a question.
Question number 38.
Question number 38. It says, which of the following is or are not branches or branch of the posterior tibial artery? Which of the following are not branches of the posterior tibial artery, or is not a branch of the posterior tibial artery? A, circumflex fibular artery. B, recurrent tibial artery. C, medial malleolar artery. D, medial and lateral plantar arteries. You have 10 seconds.
C.
Time up.
C is wrong. I get it. C is wrong. The answer is actually the recurrent tibial artery. The recurrent tibial artery is a branch of the anterior tibial artery, not the posterior tibial artery. So 0 points for participant number 5. Participant number 6, choose a question.
Question number 61.
Question number 61. That's good. It says the external intercostal muscle is replaced medially as it approaches the sternum by a membranous structure called, you have 15 seconds.
Anterior intercostal membrane.
That is correct. External intercostal membrane or anterior intercostal membrane. 5 points for participant number 6. Participant number 7, choose a question.
Question 16.
Question number 16. Question number 16 says, an autosomal dominant condition characterized by absence or hypoplasia.
Sorry, sir, I can't hear you.
An autosomal dominant condition characterized by absence or hypoplasia of clavicles, box-shaped cranium with open sutures, along with other features, is called A, Poland syndrome, B, cleidocranial dysostosis, C, Chiari malformation, and D, Reyes syndrome. You have 10 seconds.
B.
B, that is correct. 5 points for participant number 7, cleidocranial dysostosis. Though it looks like you guessed, but I've gotten the points anyways. Participant number 8, choose a question.
Question number 27.
Question number 27. Question number 27 says, about the right umbilical vein, Which of the following is correct? A, it is a potent vessel in the adult. B, it is a ligamentous cord in the adult. C, it contributes both a patent vessel and ligamentous cord in the adult. D, no non-remnant exists in an adult. You have 10 seconds.
D.
D, that is correct. 5 points to participant number 8. The left umbilical vein have no non-remnants, while
that's right.
What's the remnant? Participant number 8. Try.
For what?
You say? The remnant for the left umbilical vein this time around, not the right.
Round ligament of the liver.
That's
or
correct.
Ligamentous rex hepatis.
Yeah, that's correct. 5 points to participant to Sule Daniel. All right, so participant number 9.
33.
Okay. Sorry, I'm coming. I'm having some internet issues. Okay, question number 33. It says, what forms the superomedial boundary of the popliteal fossa? A, vastus medialis. B, biceps femoris. C, adductor magnus. D, semitendinosus and semimembranosus.
Is D.
That is correct. The semitendinosus and semimembranosus form the superomedial boundary of the popliteal fossa. 5 points to participant number 9. Participant number 10, choose a question quickly.
Question 30.
Question number 30. It says, which of the following arteries does not participate in the genicular anastomosis? A, recurrent tibial artery. B, circumflex fibular artery. C, first perforating artery. D, anastomotica magna artery, or the descending genicular artery. You have 10 seconds.
Circumflex fibular artery.
Unfortunately, that is wrong. The circumflex fibular artery gives up a genicular branch that participates in the genicular anastomosis. The correct answer is actually the first perforating artery. The first perforating artery is a branch of the deep femoral artery. It's higher up in the thigh. It has nothing to do with the genicular anastomosis. So this is the third round of questions. So we are going to go for the fourth round, second to the last round. Participant number 1, choose a question quickly. Participant number 1. I hope I'm not alone. Participant number 1 is Hag.
Okay. Question 25.
Okay. Question 35.
25, sorry.
25. 25 says, what is the typical number of common palmar digital arteries? You have 15 seconds.
5.
Unfortunately, that is wrong. There are only 3 common palmar digital arteries, which divide into 2 each to give rise to 6 proper digital arteries. All right. So participant number 2, choose a question.
Question 40.
Question number 40. It says, what are the structures involved in unhappy triad or Bologna? What are the structures that are involved in unhappy triad? You have 15 seconds.
The medial collateral ligament, the medial
That's
meniscus, and the anterior cruciate ligament.
5 points to participant number 2. That is correct, actually. The unhappy triad or the Bologna is usually one that is trauma to the lateral aspect of the knee. So the manifestation usually is on the medial side. So there is a tear in the medial collateral ligament, the anterior cruciate ligament, oftentimes. The anterior cruciate ligament and the medial meniscus. So usually the blow comes from the lateral aspect, but the injuries manifest on the medial aspect. 5 points for participant number 2. Participant number 3, choose a question. Participant number
17,
three.
sir. Question
You are
17,
not
sir.
on camera. Okay. Question 17.
Question
Identify
17.
identify the structure. Look at it. You have 15 seconds. Well, 20 seconds for this one. Identify which structure it is.
I cannot hear you clearly, sir.
Yes, you seem to have network issues. Your camera is freezing. Identify the structure. Question number 17. Can you see the camera? Can you see the screen?
Time up.
Okay. Let's give him a grace of 10 more seconds because this is
This is a tissues
You say? Participant number 3.
Time up.
Okay. Participant number 3, what did you say? I think he's having some.
What did you say?
Okay. So the answer is actually a cross section of the tongue. So this is just the histological view of the tongue. This is the epithelial lining with the papillae. These are just the muscles oriented in various directions, and these are some of the lingual glands. And then this is also all the mucosal lining. So 0 points for participant number 3. Participant number 4, choose a question.
Okay. Question 32.
Question 32. Question 32 says, which of the following is the most common type of shoulder dislocation? A, posterior dislocation. B, lateral dislocation. C, anterior dislocation. And D, inferior dislocation.
Okay. C.
That is correct. Anterior dislocation. 5 points for participant number 4. 5 points for participant number 4. You know, in the shoulder joint posteriorly, there is this coracohumeral arch, which is kind of, and also the triceps muscle, which is holding it stable. From the medial aspect, well, there is the chest wall. Laterally, it's also not very common because of the presence of the deltoid, but anterior dislocation because the capsule is more loose around there. So 5 points for participant number 4. Participant number 5, choose a question.
Question 43.
Question 43. It says the ureter passes deep to the A, femoral artery, B, the gonadal artery, C, psoas muscle, D, genitofemoral nerve. You have 10
B,
seconds.
the gonadal artery.
That is correct. Either the testicular artery or the ovarian artery. In females, the gonadal artery actually passes superficial to the ureter. 5 points to participant number, is it 5? Oh, 5. Participant number 6, choose a question.
49.
49. Number 49 says the princeps pollicis artery is a branch of which of the following arteries?
Radial
A,
artery.
ulnar artery. You say?
Radial artery.
That is correct.
B.
Next time, please allow me to read the options. 5 points for participant
Okay.
number 6. Participant number 7. Choose your question.
Question 35.
35. Which of the following, which is the most common site for the appendix found at appendectomy? A, retroileal position. B, retrocecal position. C, pelvic position. D, anterior to terminal ileum. Oh, I don't mind.
Retrocecal, B.
That's correct. The retrocecal position is the most common position of the appendix on appendectomy. 5 points for participant number 7. Participant number 8. Choose a question.
Question number 19.
Question number 19. All right. Which structure is attached to the anterolateral tubercle of the tibia or the tubercle of Jadi?
Iliotibial tract.
That is correct. 5 points for participant number 8. The iliotibial band or the iliotibial tract is actually what originates from the somewhere around the area, the iliac crest attach continuation of the tensofacial and inserts into the anterolateral tube of the tibia. All right, participant number 9, choose a question.
28.
Question 28 says, what is the principal content of the cubital tunnel? What is the principal content of the cubital tunnel? You have 15 seconds.
Median nerve.
The median nerve. Unfortunately, that is wrong. The correct answer is the
Ulnar
ulnar
nerve.
nerve. Sorry, you have chosen.
Time up.
All right, so
But actually said it before you finish.
no, but that's the thing. You have only one attempt per question, and you said the median nerve. I'm sorry, participant number 9. The ulnar nerve is the content of the cubital tunnel. So there is difference between the cubital fossa and the cubital tunnel. I bet that's what confused you. So it's
Sir, please, can you repeat the question? That question. 28.
what is the principal content of the cubital tunnel, not the cubital fossa?
Okay, thank you.
The cubital tunnel is this fibro-osseous kind of a tunnel or canal present on the medial aspect of the elbow. It is between anteriorly the medial epicondyle, posteriorly the olecranon process, and it is covered by the medial elbow ligament. So it's actually a transit for the ulnar nerve. Sometimes compression of the ulnar nerve happens there and gives you the this ulnar claw. So participant number.
Sorry, sir. Sorry to cut you, sir. Sir, please, before you go, I have a question, sir. Sorry, sir.
Okay. Go ahead.
I was answering my question the other time, and then I said the answer, and I ran out of data actually, so I was logged out. So I don't know if I actually got the answer or I missed it or it was cancelled, sir.
No, you were saying some tissue of something, and the answer was tongue. It was a
yes, I said tissue of the tongue, sir. I said like twice. Then my data ran out.
Israel, I'm compelled to agree with you because I could see that your video was not moving and you were having some network difficulties.
Yes,
so
sir.
you are participant number what?
Number 3, sir.
Number 3, unmute your mic, open your camera so that we can see you. Dauda Abdullahi, please, let's give him another chance. So
Okay, so sir, before we proceed,
yes, sir.
Yes, sir.
I guess he should try changing his location because he from the beginning of the program you can see he's changing location from place to place. So I think you should identify a specific place with very good network so that you should not have this problem again.
Okay, sir. Okay, sir.
Yes.
Thank you, sir. So you should do as he said.
All right,
Participant number 3, choose another question.
All right, sir. So question number 29, sir.
Question 29.
Yes, sir.
It says the result of fertilization include the determination of chromosomal sex and the initiation of cleavage. A, true. B, true. False. You have 5 seconds.
True, sir. True, sir. A, true.
5 points for 5 points for participant number 3. Dauda Abdullahi, please correct that. Is question 4. Is 4th question. It's true. All right. So this is the last round for the round 1. This is the last round of questioning. Let's quickly get into it. Participant number 1, choose a question.
You have omitted participant number 10.
Okay, sorry. Participant number 10, choose a question. I'm sorry. It was a mistake.
Question number 39.
Question number 39. It says, which of the following structures does not attach to the intercondylar eminence? A, the anterior limb of the medial meniscus. B, medial collateral ligament. C, anterior cruciate ligament. And D, posterior limb of the medial meniscus.
Anterior cruciate ligament.
Unfortunately, that is wrong. The correct answer is the medial collateral ligament. The medial collateral ligament has nothing to do with the intercondylar eminence. It is medial, so it's placed between the medial aspect of the tibia and the medial aspect of the medial femoral condyle. So 0 points for participant number 10. Participant number 1, the last and the final round of questioning. Quickly, participant number 1.
Okay. Question number 42.
42. It says all the following are typically found in the sarcoplasm of skeletal muscle except A. Glycogen, B. Myoglobin, C. Sarcoplasmic reticulum, D. Muscle bodies. You have 10 seconds.
D. Muscle bodies.
That is correct. Muscle bodies are typically found in neurons, not skeletal muscle sarcoplasm. 5 points for participant number 1. Participant number 2, choose a question.
I can't see the questions.
Sorry, I'm coming. Choose a question.
Question 60.
Question 60. Question 60 says, which of the following structures does not lie in the plane of the lower border of T12, that is the transthoracic plane? A. Convexity of the arch of aorta. B. Junction between superior and inferior mediastinum. C. Sternum-mandibular joint. D. Azygos vein draining into the superior vena cava. Participant number 2, please can you on your camera? All right. So.
Yes. Okay.
You say?
D.
Azygos draining into the superior vena cava.
Yes.
All right. So unfortunately, that is wrong. The correct answer is the convexity of the arch of aorta. The convexity of the arch of aorta is in the superior mediastinum. The transthoracic plane is actually at the level of the sternal angle of Lee. So it's the partition between superior and inferior mediastinum. So the convexity of the arch of aorta, maybe you misunderstood the question, is actually in the superior mediastinum, not at the level of the transthoracic plane. So no points for participant number 2. Participant number 3, choose a question.
Question 37, sir.
Question 37. Question 37. Which nerve roots of the brachial plexus form the nerve that is or are responsible for innervating the regimental bulge area? Which nerve roots of the brachial plexus are responsible form the nerve that innervates the regimental bulge originates from which nerve roots of the brachial plexus? A.
B.
C7 only. B. C5 and C6. C. C7 and T1. D. C6 only. You have 10 seconds.
B. C5 and C6, sir.
That is correct. The axillary nerve innervates the regimental bulge, and so auxiliary nerve originates from C5 and C6. The regimental bulge is this area of skin over the deltoid, so it is innervated by the axillary nerve. 5 points for participant number 3. Participant number 4, choose a question.
Question 51.
Question 51. It says the intraembryonic coelom appears by splitting of A. Paraaxial mesoderm, B. Notocaudal mesoderm, C. Intermediate mesoderm, D. Lateral plate mesoderm.
Lateral plate mesoderm.
That is correct. 5 points for participant number 4. Lateral plate mesoderm divides to give rise to the intraembryonic coelom. So participant number 5, choose a question.
55.
You say?
55.
All right. Question 55 says the vena caval opening in the diaphragm is at the level of T12, A. T12, B. T8, C. T10, and D. L1.
B. T8.
That is correct. 5 points for participant number 5. It is at the level of T8 of the diaphragm that it opens. Okay, participant number 6.
Question number 26.
Question number 26. All right. Question number 26 says, which muscle inserts into the middle of the lateral aspect of the radius at the point of maximum convexity? A. The supinator muscle. B. Biceps brachii. C. Pronator teres. D. Brachialis muscle.
Supinator.
Unfortunately, that is wrong. The correct answer is the pronator teres. This question kind of reminds me of Dr. Dauda. Dr. Dauda Abdullahi, basically. Well, he likes this particular question, so it's unfortunate that you couldn't get it correct. But I bet most of my classmates that are here are going to know that it's the planetoid that inserts onto the lateral aspect of the middle of the radius at the point of maximum convexity. 0 points for participant number. Is it 5? I think 5. Yeah. Participant number 6.
7, sir.
Okay, participant number 7. Choose a question.
Question 52.
Nerves of the pelvis. This is about the nerves of the pelvis. Branches of the sacral plexus include all except A. Nerves to piriformis, B. Pelvic splanchnic nerve, C. The obturator nerve, and D. The pudendal nerve.
Obturator nerve.
That is correct. The obturator nerve comes from the lumbar plexus, not from the sacral plexus. 5 points to participant number 7. Participant number 8, choose a question.
Okay. I can't see the question, sir. Okay. Can you hear me?
Yes. I hope other people are seeing the screen.
Question number 53.
53. So you can see the screen now.
Yes, I can see it now.
Okay, so the esophageal opening in the diaphragm is opposite A, T6, B, T8, C, T10, and D, T11.
T10C.
That is correct. 5 points for participant number 8. Participant number 9, choose a question.
54.
54. 54 says, which of the following passes through the diaphragm with the esophagus? A, azygos vein, B, right vagus, C, the sympathetic trunk, and D, the thoracic duct.
Right vagus. B.
That's
Time
correct.
up.
The vagus nerve. Okay.
B.
So that is correct. 5 points for participant number 9. Participant number 10.
Yeah,
choose a
answer.
question. Yes, he answered before you said time up. He actually answered before you said time up. Participant number 10.
Question 41.
Question 41. It says a midline abdominal incision below the umbilicus passes through all the following except A. Pyramidalis, B. Linea alba, C. The extraperitoneal fat, and D. Transversalis fascia. You have 10 seconds.
Pyramidalis. Pyramidalis. Pyramidalis, option A.
Time up.
I'm interested. So you guys, I had a little bit of a network issue. So I'm going to continue sharing my screen. All right. So Ahmad Atahir, please, participant number is it 9? What was his
Number
answer?
10. I said
He said
pyramidalis.
pyramidalis.
It was
Before
within
time.
time.
Yes.
Okay, so that is correct. Pyramidalis actually does not cross the midline, so it's present bilaterally on each side of the midline. So when you are incising below the umbilicus, you are not going to go through the pyramidalis because it's not a midline structure, it's a paramedian structure. So that is correct. 5 points to participant number 10. All right. So I think this brings us to the end of the first round of the anatomy quiz version 2.0. The scorer, Ali Abdullahi.
Yes, sir. I would like to
I
project
think
my screen.
before the school,
Okay, sir.
some of the audience are protesting in the chat section that earlier before the program started, you promised that there will be a question for the audience, but up to now there is no question for the audience or something like that.
Okay.
So
All right. So I understand that. I think we should just do a random 2 to 3 ones here. I prefer the question for the audience to be in section 2 because that's the round 2 because that's where there are nicer questions. So, but anyways, let's get 2 to 3 questions, basically for the audience. So for the members of the audience, you have 20 seconds to attempt this question. You will do it by raising hand. It has an algorithm. Automatically, the first person to raise hand is going to appear on the top. So he's going to answer the question, he or she. So it says the support of the uterus, either directly or indirectly, is provided by the following structures, except A, the perineal body, B, the mesosalpinx, C, the transverse cervical ligament, D, the levator ani muscles. Okay, Abdul Malik Muazu, unmute your mic and speak.
The levator ani muscle. D.
The levator ani muscle. Unfortunately, that is wrong. The levator ani muscle provides support indirectly to the uterus. It's actually the mesosalpinx that hold the uterine tube in place. Okay, so let's try another question. Let me look for a nice one. Now let's try this one. Nope, this is too simple. Sorry guys, another network issue, but let me figure it out. I'm looking for a nice suitable question for the members of the audience. Well, basically, I think we should just meet in the next section regarding the audience. So please, am I audible?
yes.
Yes, sir.
Yes. So which of the following is true regarding the intercostal nerves? Well, this was already attempted. So I think we should just get into round 2. Before then, the Ali Abdullahi said he want to share his screen. Ali Abdullahi, if you are around, sir, please proceed. Share your screen and let us know.
I'm trying to. I'm trying to share the screen, but I don't know what's wrong. It is saying that the host is not allowing sharing for this meeting.
Okay, sorry, let me try to edit that quickly.
Okay.
Let me try to enable it.
And lastly, Muhammad Dauda Abdullahi, participant number 5.
Okay.
These are the 7 participants that have scaled to round 2.
Okay. Zaka iya rubuta ko a littafin ko kai making note or something. All right. So if I heard you well, participant number 2, participant number 3, participant number 4, participant number 6, participant number 7, and participant number 8 are all in the game.
Yes, sir. Did you mention participant
Am
number
I right?
5?
Okay. Participant number 5 couldn't make it. I think that was a mistake. He couldn't answer his question. He was contending with participant number 2, and participant number 2 made it out. I think you have a mistake in your recording.
So I mistook his score for who?
No, there is no mistake. In the tiebreaker, the marks in the tiebreaker are not going to reflect in the final result. So between him and participant number 2, they were given a question which says, mention 2 of the 3 athletes that participate in anastomosis around the acromion, and she mentioned the 2 before he mentions 2. He mentioned only 1. That was correct. He mentioned many, but 1 that was correct, which is the suprascapular artery.
Okay, thank you.
All right. So the participants are participant 2, 3, 4, 6, 7, and 8.
Okay, thank you.
Are we together? 2, 3,
yes.
4, 6, 7, and 8.
Yes, thank you, sir.
All right. So we are going for
that's 6 participants.
Okay, thank you very much, sir. Round 2. So let's just dive in directly without wasting a lot of time. Participant number 2, please choose a question.
Sorry, is that
number
me?
2. Sorry, am
Sorry,
I not
sir,
sharing?
I
I don't
just
think
went
you
out
are
when you
participant
were
number
talking
8.
about the participant, and I'm seeing my name under that participant number 2. Is that me?
No, you should maintain your participant number 8. I guess you are participant number 8, right?
Yes, sir. Okay.
So you should maintain
So you are
that
going to
number.
maintain participant number 8. It's not the number, it's just the name. Maintain that you are participant number 8. Okay. So participant number 2, are you Hindu? Am I audible? Are you Hindu?
Yes, you are.
Participant number 2, are you Hindu? Please choose a question. Oh, this is. Well, I think we are going to proceed. If she's having a network issue and rectify it, then she can answer her question later. Participant number 3.
Question number 3, sir.
Sorry, participant number 3. I think participant number 2 is here. Maybe she's having difficulty with the network. Participant number 2, can you please choose a question? Participant 3, choose a question. Let's continue.
Question number 3, sir.
Okay, question number 3. It says, this is a cadaveric image of the heart oriented in the anatomical position. Identify the vessel highlighted with the red arrow. You have 15 seconds.
Anterior interventricular artery.
That is correct. 5 points for participant number 3. It is actually the anterior interventricular artery or the left anterior descending artery. All right. So participant number 4.
Okay, question 4. 4.
You said question number 4? Okay. Question number 4 says, mention 3 muscles innervated by the nerve highlighted by the green arrow. So this is a section showing the brachial plexus of the left upper limb. So this is the nerve that is pointed by the green arrow.
Bicep. I have
You
brachialis
have,
and coracobrachialis. Bicep.
you say, start from the beginning, sorry.
Bicep,
Please be
brachialis and
audible, part.
coracobrachialis.
Brachialis and coracobrachialis. Continue.
Bicep, brachialis
Time
and
on.
coracobrachialis.
Unfortunately, that is wrong. The nerve highlighted by the green arrow is actually the median nerve. The median nerve supplies a lot of muscles in the forearm. So Ali Abdullah, we're going to be having only 4 questions in this section because of the time factors. All right. So the answer is actually, we have the flexocarpidedialis. We have the flexodigitorum superficialis. We have the lateral half of flexodigitorum profundus. We have the pronator quadratus. And if you go, we have palmaris longus. Into the palm, we have abductor pollicis. We have opponent's pollicis. So these are all the muscles. So sorry. No points for participant number 4. Participant number 6, choose a question, please.
Question
Participant
number
number 6.
24.
Can we see you, please? I'm not seeing you on camera.
Number 24.
Okay, 24 says, what forms the inferomedial boundary of the popliteal fossa? You have 10 seconds.
Medial head of the gastrocnemius muscle.
Okay. People often forget that plantaris contributes to that, so you are going to only get 4 marks for this question. Plantaris also contributes to the medial inferomedial boundary of the popliteal fossa.
Okay.
All right, so 4 points for participant number 6. Participant number 7, choose a question.
Question 7.
Question 7. It says the picture shows the dorsal aspect of the sacrum. Identify the opening pointed by the green arrow, by the red arrow, and mention one structure that passes through it. So I'm talking about this area. Something passes through this place. What is the name of the opening?
Sacrococcygeal opening.
Okay.
In medial sacral artery. Sacral artery.
No, okay. Unfortunately, it is wrong. The opening is actually called the sacral hiatus. It's called the sacral hiatus, and the contents, it could be the filum terminal, the coccygeal nerve roots, fifth sacral nerve. So no points for participant number 7. Participant number 8, choose a question.
Question number 9.
Question number 9. It says, identify the muscle, its nerve supply, and its main action. This muscle. This is the dorsal view around the scapular region. So which muscle is this? And then what's its nerve supply?
The red tag. The one tagged
You say?
red.
Yes, the
Is
red
it the
arrow.
one tagged red?
Yes, the red arrow. You have 15 seconds.
That's terex major.
Okay.
Then what's the second question?
Nerve supply, main action.
And terex major, and then it is supplied by the lower subscapular nerve.
That is correct.
Then
Action.
the action.
Okay, Atahir.
The action of the terex major muscle is lateral rotator.
The main action, it's a powerful adductor of the upper limb. So you got many of the components correct. So 4 points for participant number 8. Okay. Please, henceforth, if any of the participants have a complaint, you should just raise his hand and talk directly instead of calling me. Calling me only disrupts the entire quiz process. Okay. So participant number 2, are you around, please?
Yes, sir.
Choose a question.
Question 15. I can't hear you.
So stock issues. Ahmad Atahir, please, what answer within time?
You said? Hello, Abdurrahman.
Yes, yes. Have she answered, and was it within time?
No, the question didn't pop up before you have that network issue. So I think you did not read the question.
Okay.
We
So
didn't see
can you
the
choose
question,
another
all of
question?
us.
Participant number 2, choose another question. Oh, what was the first question you
Okay.
chose? Well,
Question
choose
Please
another
choose
15.
question
question.
15.
You say?
She choose question 15. But
Okay,
we did
but
not
let
see
her
the
just
question,
choose
all
another
of us.
question
So
so that we will be fair.
Okay, question 20.
Okay, question 20. Please, can I see you on the camera? I can see you. All right. So question 20 says, when is considered the period of organogenesis in embryology? You have 15 seconds.
Okay. During the embryonic period, that is 3 to 8 weeks.
That is correct. 5 points for participant number 2. So that's your first question. Now choose another question as your second question. And sorry, please, you need to give us a plausible explanation for why you were absent. Was it network issue? What was it? Participant
It was
number 2.
network issue. I wanted to connect, but I couldn't see the screen.
Okay, so can you, okay, on your camera, choose another question. This is your
Okay.
second question. Now we are going for the second
30.
round of questioning. Question 30.
Okay.
It says identify the highlighted muscle and mention its nerve supply. This muscle here that is highlighted in yellow. This is the palmar aspect of the hand. the right hand to be the left hand to be specific.
Okay. The adductor pollicis.
Okay. The nerve supply.
The nerve supply is the ulnar nerve.
Ahmad Attire, is she within time? The answer is correct.
Yes.
Actually, it is adductor pollicis. Is the deep palmar branch of the ulnar nerve. So 5 points for participant number 2 again. Participant number
Sorry,
3.
before we proceed, is it
Yes, sir.
10 seconds or 15 seconds for this picture questions?
15 seconds for picture questions.
Okay,
Any question
okay, so
without
she
option, 15
is within
seconds.
time.
Yes. So participant number 3, quickly, please.
Question number 12.
Question number 2.
12,
It says
12,
a
like
band of cardiac muscle. So members of the audience, anyone who answers this question is going to get 2,000 naira. A band of cardiac muscle found in the right ventricle that connects between the interventricular septum and the right ventricular musculature, as well as carry the right bundle branch, is called audience.
Moderator
2,000.
band. Moderator band.
Raise your hand before you speak.
I
Ismail,
think
please mute your
Sunday
mic.
Omeke is a participant. Was a participant during the first round.
Okay, so
answered.
audience, please, members of the audience, anyone? For 2,000 naira, a band of cardiac muscle found in the right ventricle that connects between the interventricular septum and the right ventricular musculature, as well as carry the right bundle branch, is called
Moderator
since
band.
who
Moderator
answered it?
band.
Who is that?
It's me, moderator band.
Your name?
Omeke Sunday.
Okay, that is correct. But are you a participant in this quiz?
Yes.
Yes.
He was a participant during the first round. So I think the
Okay.
question for the audience is not for
So the answer is
participants.
correct anyways, but we are going to deal with your issue later. You know? Okay. So participant number 3, you said question number 12, right?
12, yes, sir. 12, sir.
Okay, so let's quickly run this thing up. An artery formed by anastomosis between the superior and inferior mesenteric arteries that runs along the margin of the colon, providing collateral circulation, is called. I'm not seeing your face.
Yeah, can you see me?
Yes, answer the question.
Can you see me now, sir?
Are you gonna chop in sir? Are you the chaba?
Ismail, what's your answer?
Time off.
All right. The answer is actually the marginal artery of the colon, or the marginal artery of Drummond. It is an anastomosis formed, multiple anastomosis between the branches of the what is it called, superior mesenteric and inferior mesenteric, around the colon, like that. So and then there is even a window that is prone to ischemia. They say the junction between the right 2/3 and left 1/3 of the transverse colon, or proximal 2/3 and distal 1/3 of the proximal of the transverse colon. So 0 points for participant number 3. Participant number 4, quickly choose a question, please. We have much exceeded our time. Participant number 4. You are not very audible. Please try to be audible. Question 10.
Yes.
Sorry, Abdurrahman, we cannot hear you. Hello.
So I say question 10.
I think the quiz master have a technical glitch, so we should please be patient for some seconds.
Sorry, guys. Just becoming more annoying. Okay, participant number 4, choose a question.
Yes, choose question number 10.
All right, question number 10. It says, this is the dorsal aspect of a cadaver. Identify the muscle, its nerve supply and insertion. This muscle that is pointed by this red arrow. What is the muscle? What is its nerve supply and what's its insertion?
That's okay.
You need to raise
Hello?
your voice. I don't know what's wrong with your voice. Please raise your voice.
Latissimus dorsi. Then thoracodorsal
Ahmad
nerve.
Atahir, can you
Then
hear what he
insertion
is saying?
Yes. Time
I said
up.
latissimus
He
dorsi.
attempt 2 questions. He said the muscle is latissimus dorsi, and he said thoracodorsal nerve. So before he answered the next question, time is already up. So he answered 2 questions within time. But
Okay,
it
so
did
that's
not
4 points.
I said
Okay, Muhammad Tahir, calm down, please. All right. So the answer is correct. It is
Yes,
latissimus dorsi. It is supplied
you
by the
answer it,
thoracodorsal nerve.
but not within the speculated time.
Okay, Ahmad Atahir, thank you. So 4 points for participant number 4. Participant number 6, please choose your question.
Question number 26. Did you hear me?
You said which question, Mustafa? Which question?
26.
Okay. Sorry, Mustafa. We are waiting for the quiz master, the host.
Thank you very much, Ahmad Atahir. I have changed the machine because I was having a lot of network issues with the MTN. So we were on participant number 6. Participant number 6, choose a question.
You said question 26.
Okay, question number 26. The coronal section of the female reproductive organ showing the uterus, the fallopian tubes, and the vagina. Identify the pointed structure. So we have the uterus, the vagina, and the fallopian tubes. So what is this structure that is pointed like this? What is the structure present here bilaterally? You have 15
Broad
seconds.
ligament.
The broad ligaments. 5 points for participant number 6. Participant number 7, choose a question, please.
Okay, question 16.
Question 16. It says, which structure is formed by the union of the right ascending lumbar vein and the right subcostal vein at the level of T12?
The azygos vein.
The azygos vein. 5 points for participant number 7. Participant number 8, choose a question, please.
Question number 31.
31. It says, identify the artery on the ventral aspect of the forearm and mention its origin. So this is the ventral aspect of the forearm, the right forearm to be specific. So this artery that is highlighted, that is pointed by this yellow arrow, what's the artery and what's its origin?
Okay, the artery is anterior interosseous artery. Then it arises from the
That's
common
correct.
interosseous.
That is correct. The common interosseous artery originates from the ulnar artery. 5 points for participant number 8. Participant number 2, choose a question, please.
Yes. Okay. Question 14.
Question 14. Question 14 says, the lesser sac communicates with the greater sac through
The epiploic foramen.
the epiploic foramen or foramen of Winslow. 5 points for participant number 2. Participant number 3, choose a question, please.
Question 21.
Question 21. It says, and this is the anterior aspect of the right hip joint. Identify the highlighted structure and mention its eponymous name. So yesterday I tried to explain what eponymous means to so that you understand. So what's this structure and what is its eponymous name?
New femoral ligament. Can you hear me, sir?
Yeah,
We
but
can
you're not
hear
very
you.
audible.
You
Mention
mentioned
it
the
again.
ligament.
Iliofemoral ligament.
Okay, what's its eponymous name?
Time up.
3 points for participant number 3. You got it. It is the iliofemoral ligament. It is also called the ligament of Bigelow. Inverted Y-shaped ligament. It is the considered the strongest ligament in the body. Well, at least it is the strongest ligament in the hip joint. So that's the iliofemoral ligament or ligament of Bigelow. 3 points for participant number 3. Participant number 4, choose a question, please.
Okay. Question 5.
Abdurrahman.
Yes, Atahir.
I think before you proceed, the participant, the last person that attempted the last question, did he say iliofemoral ligament or anterior-femoral ligament? I had anterior-femoral ligament.
Alamin, please, what have you had? What was it that you hear? Alamin. Dauda Abdullahi, what did you hear, please?
I'm not sure. Yes, yeah.
Maybe the participant should indicate, or maybe the members of the audience.
Muhammad Tahir, what was it that you hear, please?
I think he said iliofemoral.
Yeah, I think that's what I had. So
Okay.
Aliyu
Thank
Hindu,
you.
please, what did you hear? Thank you, sir.
Actually, I can't say, but maybe it's iliofemoral.
All right. So I think
Okay,
let's
yes.
proceed. Okay.
Someone said
Participant
that
number
he
4.
actually said iliofemoral ligament, so it is settled.
Okay.
I'm back,
Thank
sir.
you.
Hello,
Thank you,
sir.
sir. Thank you for the observation. Participant number 4.
Hello, sir. Please, can I ask a question, sir?
Who is it? Okay, Ola Israel, what is your question?
Yeah, the question I wanted to know if I thought I got it.
You say?
Yes, you got the question.
The question, you got 3 points in the question because you answered the first part, not the whole question.
What happened to the network? I answered before my network had glitch. Yes, sir.
No, I don't think
Yes,
you
you
had
didn't
any.
mention big.
I
You
don't
didn't
think you had
mention the
any
ligament of big
network
lobe.
problem during that question because
Yeah,
you
exactly. You
answered
didn't mention the ligament of
iliofemoral
big lobe.
ligament, and you are trying
Yes,
to answer the next question, but time is already up before you said
Okay.
anything. Yes.
Okay, sir.
Thank you, Ahmad Tahir. All right. So,
okay, sir.
Participant number 4, please. Muhammad Tahir. Muhammad Tahir. Muhammad Tahir, participant number 4. Am I having a network issue? Ahmad Tahir, please, can you hear me?
Yes. Someone indicated that Muhammad Tahir cannot access the link or something like that. I don't think.
But I just saw him. I can see him on video. He cannot unmute yourself, Muhammad Tahir. You are muted. Unmute yourself. Yeah,
Yes,
so choose
he
a
is back.
question.
Back.
Question what? Muhammad Tahir, what's your question?
Question 18.
Please, next
He
time you
said
are
question
speaking, you should
18.
make sure you are. Yeah, I get it. Next time you are asking, you are talking, please come close to the mic, please. You are far from the mic and you talk a little bit deep. So, name the structure that passes through the space pointed by the arrow. So this is the dorsal aspect of the scapular region, or the scapular region. So you can see an opening here. Which structure passes through here?
Axillary nerve and posterior circumference of the artery and vein.
All right. So unfortunately,
Axillary
that
nerve,
is wrong.
posterior.
They pass through the quadriangular space, not the upper triangular space. In the upper triangular space, what passes through is the circumflex scapular artery and vein. Thank you. 0 points for participant number 4. Participant number 6. Choose a question, please. Participant number 6.
Question number 33.
Okay, question number 33. Question number 33 says anterior aspect. This is the anterior aspect of the proximal tibia. Identify the highlighted structure. This area that is highlighted by this red circle.
Intercondylar area.
Yeah, that's the intercondylar area or the intercondylar eminence. So 5 points for participant number 6. Participant number 7.
Question,
question
20. 25.
All right. Question number 25 says identify the artery and name its main branches. So this is the abdomen. You can see the stomach and the liver here. So what is this artery, and what's its 2 terminal branches or its 2 main branches?
Okay, common hepatic artery.
That is correct.
Then right and left hepatic artery.
Unfortunately,
One
that's
to the
wrong.
right.
3 points for participants. number 7. This is the common hepatic artery. The common hepatic artery divides into the proper hepatic artery and the gastroduodenal artery. The gastroduodenal artery go ahead to give rise to the one of these arteries, and then also, well, there is a question about that, so I'm not going to mention the answer. So the common hepatic artery and its branches are the proper hepatic artery and the gastroduodenal artery. Participant number 8, Suledani.
Question number 11.
Question number 11. It says this is the lateral aspect of the right innominate bone. Identify the cycled area. This is the cycled area, the area cycled in red. What is this area called?
Anterior inferior iliac spine.
Anterior inferior iliac spine. Unfortunately, that is wrong.
Wait, excuse me. Let me view it again. This is iliac tubercle.
Unfortunately, that is wrong. The iliac tubercle is high up here, and you cannot make more than one attempt. The answer is actually the iliopubic eminence. That is the iliopubic eminence. The anterior inferior iliac spine is just below the anterior superior iliac spine. This is the iliopubic eminence. So 0 points for participant number 8.
Abdurrahman.
Yes.
Yes, before we proceed, I noticed something. Sule Daniel, can you hear me?
Yes, sir.
Please, for your video, you should try and, let's say maybe dress properly, because the video is like, yes.
So thank you very much for the observation. You are doing well. Thank you, sir. Participant number 2, quickly choose a question, please. This is the last round of questioning.
Okay, question 40.
Participant number 2, question number 40. It says, identify the muscle and mention the nerve roots of the nerve that supplies it. So what is the muscle and what are the nerve roots? The muscle that is pointed by the green arrow, this muscle.
The diaphragm. And it's supplied by the phrenic C3, C4, C5.
5 points for participant number 2. Participant number 3, choose a question. She have answered the question before you time was up.
Okay.
Participant number 3.
Question number 23, sir. 23.
Question 23. The principal type of collagen found in the basement membrane is?
Time up.
All right, the answer is type 4 collagen. That's the one that is predominantly found in the basement membrane. So 0 points for participant number 3. Participant number 4, choose a question, please. Participant number 4. Muhammad Tahir. Muhammad Tahir Yahya, please, can you respond? I don't know what is wrong with Muhammad Tahir. On mute, open your video, ask, choose a question, please. Muhammad Tahir. All right. Participant number 6, choose a question, please.
Yes, Muhammad Tahir is back. Muhammad Tahir.
Okay, I understand. Muhammad Tahir, what's your question? Muhammad Tahir, choose a question. 32. Muhammad Tahir, question what?
Question 13.
Question 13?
Yes.
All right. It
Yes.
says, what is another name for the lesser sac in the abdomen? What is the name other name for the lesser sac?
Mental bosa. Or
Mental
mental
bosa.
bosa.
5 points for participant. 5 points for participant number 4. Participant number 6. Choose a question. Participant number 6.
Question number 17.
Question number 17 says the smooth fibromuscular ridge on the posterolateral wall of the right atrium that demarcates the smooth part of the right atrial wall from the rough part is called the smooth fibromuscular ridge on the posterolateral wall of the right atrium that demarcates the smooth part of the right atrial wall from the rough part is called
Aortic sinus.
No, unfortunately that is wrong. The correct answer is the crista terminalis. 0 points for participant number 6. Participant number 7, choose a question.
Question 38.
Question 38. The audience, please bear a little more patience. You are going to answer the rest of the questions. Then there will be prizes and it will get bigger and bigger. So question 38 says, this is the visceral surface of the liver. Identify the pointed structure. So this is the undersurface of the liver. So you can see a structure passing here. What is this structure?
I think everything is the falciform ligament, and that's the paraumbilical vein.
Well, it's the falciform ligament containing the round ligament, not paraumbilical vein. So you have 5 points. 5 points for participant number 7. It's falciform ligament, but it contains the ligamentum teres hepatis, or the round ligament of the liver. Anyway, you identify the structure to be falciform ligament, and that answers the question. So participant number 8, the last question in this round. Dauda Abdullahi, I hope you are getting ready. Yeah,
Yes,
participant number 8, choose a question.
23 has been answered, but
yes.
Okay. Give me question 29.
Question 29. It says, when performing a lumbar puncture, the spinal needle does not pass through the A, ligamentum flavum, B, the posterior longitudinal ligament, C, the supraspinous ligament, and D, the interspinous ligament. Thank God you are a 300 level student.
The answer is B.
Yeah, that
posterior
is correct. 5 points for Suledani. Posterior longitudinal ligament does not actually, it's more of the anterior wall of the vertebral canal, so it doesn't just get passed by the spinal needle during spinal tap. So congratulations. That's 5 points for participant number 8. All right. So I think while the quiz master, while the scorekeeper is calculating everything, we are going to be busy answering some of the questions. So the members of the audience, are you ready, please? You can react so that I know you are ready. React with emojis.
Abdurrahman.
Yes.
I think in case of any tiebreaker, can't we just wait for the result before we
Yes,
can you
that
hear
is
me?
true. So, yes, I can hear you.
Can't
We are
we
going to
wait
answer
for the result
only.
before?
Yeah, we are going to answer only a few questions. So when
Okay.
we do the tiebreaker, we'll finish the others. Yeah. So participants,
Okay, no problem.
Members of the audience, are you ready, please? Members of the audience, react with emojis so that we will know you are ready. Okay, so let's start with question number 22. Which muscle is commonly referred to as the peripheral or the second heart, and why? Which muscle is considered the peripheral heart, and why is it considered so? Any member of the audience is entitled to a prize if he answers the question correctly. Raise your hands if you know the answer. The peripheral heart.
Soleus, sir.
You are supposed to
Hello?
raise your hand, not speak. Who is it? Who said Soleus?
Mahmoud, sir.
All right. So Ahmad I hope you are taking note of the people that spoke. Mahmoud Musa answered a question correctly. It is actually the Soleus. So the second part of the question, why?
Yes.
Mahmoud Musa, why?
Okay. The reason is because during movement, it usually increases venous return to the heart. I think so.
Exactly. It contracts and compresses on the lower limb veins and then push blood back towards the heart. That is correct. You will have a prize, and Ahmad Attai is taking note of that. Question 32. The myelin sheath is produced by which cells of the central nervous system? Raise your hand if you know the answer. The myelin sheath is produced by which cells of the central nervous system? Young prof, speak please.
I think it's being produced by oligodendrocytes.
That is correct. What is your name?
Imam Umar Dairu.
Imam Dairu. Ahmad Atahir, take note of that. It is
Yes, he said
oligodendrocyte.
Imam Umar Dahiru, right?
Oh,
Yes,
yeah,
sir.
yes.
Okay.
All right, so let's go for question 27. Ali Abdullahi, please let us know when you are ready. The
I'm
principal
ready,
cell
sir.
type
Whenever
found.
you think it should be announced, just
Okay.
let me know. I will
The
project
principal
and then
cell
I will.
type found in the lacunae of cartilage is the. Who knows the answer? Fatima Hassan, speak. Fatima Hassan.
Chondrocyte.
That is correct. That is correct. Fatima Hassan. That is correct. So Ahmad Atahir.
Yes.
Fatima Hassan got a correct answer.
Fatima
Right.
Hassan Umar or Fatima Hassan?
Fatima Hassan.
Okay.
Ali Abdullahi, I think you can proceed. Let me stop sharing the screen. Thank you.
Okay. This is the final result for the quiz. Are you hearing me? Hello?
We
Hello,
can
am I
hear you.
audible?
Continue, sir. Yes, you are audible.
Yeah. Okay, this is a summary for the quiz. And here with me, I have the result of the winners. The first position is Sule Daniel. He scored a total of 39 points.
Congratulations, Sule Daniel. That is great. All right, continue, sir.
Thank you. Then the second position is Aliyu Hindu. She scored a total of 35 points.
That's good. That's great.
Then the third position is Musa Mustafa Garkua. He scored a total of 34 points.
That's great. Congratulations.
Then the fourth position is Olu JD Timothy. He scored a total of 33 points.
Congratulations, Timothy.
Then the fifth position is Atoyebi Oladura Israel. He scored a total of 28 points.
Congratulations, Israel. That's
Yes,
wonderful.
and I hope all the winners and the audience are able to see the prizes tagged to each of the position.
Yeah.
So the quiz master will go ahead to announce, and I congratulate every participant for participating and also congratulate the winners. Thank you very much.
Thank you very much, Aliyu Abdullahi. Thank you very much, everyone. I don't know, Dr. Dauda, sir, please, are you around so that we can hear if you have any observations, sir, or any corrections?
Yes.
Sir?
Yes, thank you very much. I'm here. I want to congratulate you on finishing this exercise. Of course, we know the challenges of conducting an online quiz, chief among which is always network issues, especially in our setting. But I think that despite all those challenges, you have really done well with this organization. I think I want to congratulate all the participants from the first round and second round. I think they have done very well. It's not easy to participate. And also, I also congratulate the winners as well for doing very well. I have noticed that you have not attached any prize to Mohammed Tahir Yahaya. So I would offer to make a donation prize to him for his participation. So you can forward me his account details, Abdurrahman, so that he can also get a consultation prize as well. So thank you.
Thank you very much, sir. Thank you very much, sir. We are grateful, sir. Thank you, sir. Thank you very much, sir. We are really grateful for this offer on behalf of Muhammad Tahir. Thank you, sir. Mr. President, the former president of Adbumsa. I'm sorry, please, I forgot to acknowledge the presence of Muad Sadiq, the current president of Adbumsa, who is also on our guest list. He is not actually a guest. He's my friend. We've been 6 years together, although I'm not sure if he's around now. Muad Sadiq, are you around, please? Well, I think he's not around. So, Mr. President, Dr. Abdul Mumin Ibrahim, please, we will love to hear you say a few words to the participants and the winner.
Okay. Thank you very much. Good afternoon, all. I would like to congratulate all the participants, those that participated in the first round, to those that make it to the second round, and the winners. You all have gained something. You have refreshed your anatomy and you have learned something. Above all, some people have even emerged best among the contestants and have taken something back home. I congratulate you and I encourage you to do more. Keep giving in your best and also take this knowledge with you and pass it on to others. I pray that may God continue to guide you and bless you all. Thank you very much.
Thank you very much, sir. On behalf of the winners and all the participants and even the members of the audience, I'm still thankful to Dauda Abdullahi, grateful to Dr. Dauda Suleiman for sparing his precious time and attending a small program of ours. That is very encouraging and we are really grateful, sir. Thank you very much, sir. Thank you very much, Dr. Abdul Mumin, for your presence. So before we end the quiz, we are going to give the participants a room to answer the rest of the questions and then get prizes for them. So let me share my screen and continue quickly, and then we call it a day. So the members of the audience, Mahmoud Musa, can you please lower your hand so that we'll know when you raise your hand or if it's just there? Mahmoud Musa. Yes. So let's try from number 1. So during cardiac surgery, dash allows the surgeon to pass his or her fingers to isolate the pulmonary trunk and the ascending aorta for as shown in the picture. What is the name of this of such space? The space through which this individual passes his finger to isolate the ascending aorta and the pulmonary trunk. Only audience, not participant. Participants, please lower your hands. All right. Fatima Hassan, speak.
I think it's the oblique sinus.
All right. Unfortunately, that is wrong. Any other contrary opinion? Aishat Yakub?
I think that's the transverse sinus.
Yeah, that is correct. That is the transverse sinus. That is the transverse pericardial sinus. So Ahmad Atahir, Aishat Yakub. Okay, so let's
Okay,
go for
noted,
question
sir.
number 5. The picture shows the posterior aspect of the left knee joint. Identify the structure pointed by the yellow arrow. So this is the posterior aspect of the left knee joint. Okay, Abu Abdullahi, can you, Abu Abdullah, speak?
Yes, posterior cruciate ligament.
That is correct. What is your name?
Abdul Malik Muazu.
Abdul Malik Muazu. Ahmad Atahir, it's the posterior cruciate ligament. He is correct. All right.
Yes,
So
Abdul Malik Muazu, noted.
Yes, sir. So
Abdul Malik
question number
Muazu.
6. Which nerve innervates the
Aishat Yakub, Abdul Malik Muazu.
Which nerve innervates the tensor-fascial lateral, and where does the muscle insert? Anyone from the audience? Fatima Hassan, speak.
The it inserts on George's tubercle.
Okay.
It inserts
The
on
nerve
the
supply.
iliotibial tract.
You say?
The tensor fascial lateral, it inserts on the iliotibial tract, which
Okay.
is inserted on the George's tubercle. And then I think
Okay.
it's innervated by the inferior gluteal nerve.
Inferior gluteal nerve, are you sure? All right.
I'm not
It's
sure. I
actually
think
innervated
superior or inferior.
by the superior gluteal nerve. Ahmad Atari, she answered 1.5 question, so it's 1.5 now. Okay. So okay.
Miss Abdurrahman, sorry for my interruption. We are not seeing her face. I doubt if there is transparency in answering her question, and she takes time to answer her question.
Thank you very much
Yes,
for
I also
raising such
noticed
an
that. I
observation.
want to raise such an observation before.
Okay, so thank
I
you.
think the rule
Members of
applies
the
to
audience,
all,
please
the
note
participant
that
and
you
the
should
audience. If you are to answer a
be seen
question,
on
you should
camera.
be
You should be seen on camera while attempting a question. All right, so we are going to open the next question. Question number 8. Identify the muscle and its innervation. This muscle, you can see a bigger muscle reflected, and then there is a muscle here. So what is the muscle and what's its innervation? Anyone? Fatima has an attempt. Go ahead.
The P is the pectoralis minor,
Okay.
and it's innervated by the medial pectoral nerve.
We are not seeing you. And it is innervated by what?
The medial pectoral nerve.
Why can't you have, okay, you cannot say on camera, okay. So, okay. That is correct. I'm at a tile 2.5. Pectoralis minor innervated by the medial pectoral nerve. All right. So, question number 19. Wow, this is an interesting question. I'd love someone to answer this question. Identify the artery and name its 2 terminal branches. Who is going? Anyone? This artery that is pointed by the arrow. Okay. Dauda Abdullahi, can you unmute your mic and speak?
I'm sorry.
You say?
Lowered my hand.
Okay, you have lowered your
I
hand.
lowered my hand.
Okay. Anyone from the members of the audience? Anyone? Okay. Fatima Hassan. But now we need to see you on camera, please.
I think it's the internal thoracic nerve.
Okay. Are you sure
And
it's
then
enough?
artery, sorry, internal thoracic artery.
It's not
And
on
then
camera. It's not visible.
of All right, I'll open my camera.
Okay.
It's internal thoracic artery, and then I think the terminal branch includes the superior.
Uh-huh.
I can't remember, but
Okay.
I can't
It's the
remember. Sorry.
musculophrenic and the superior epigastric arteries. So
Yes,
you got,
yes.
you get 0.5 for this one, and she already have, I think, is it 2.5 for? So that's 3. She answered 3 correct questions to audience. So question 28. This is open to even participants that participated in phase 1. What is it called? Round 1. So dorsal view of the foot, identify the artery and mention its origin. No, so that I know. Mahmoud Musa. Well, Mahmoud Musa, speak.
Is the okay, Mike Scrimba?
Yeah.
Is the dorsalis pedis artery, and it arises from the anterior tibial artery.
That is correct. Another point for Mahmoud. So he have answered 2 correct questions so far. So, which artery supplies the cardia of the stomach and mention its parent artery? So who is going to go for this one? Cardia of the stomach supplied by which artery and what's its parent artery? Anyone? Any other person? I don't want. Suledani is the winner. Okay, Olojedi, speak.
The short gastric artery.
Okay.
What gives the branch of splenic artery.
Yeah, that is correct. But the main arterial supply to the cardiac end of the stomach is actually the left gastric artery, which originates from the celiac artery. But the short gastric arteries contribute, so you are going to get your full point. Olojede also answered a volunteer question. Ahmad Atayir, I hope you are noting all this.
Yes, is this one open to all the audience and the participants?
Yeah, participants of round 1.
Okay,
yeah.
because this person, I think he is one of the participants.
Yeah, understand. Yes. So the allantois contribute to the formation of which organ in the adult? Mahmoud Musa. Okay, Mahmoud, go ahead. Nobody else is raising hand, so go ahead.
Okay, I think the urinary bladder.
Yeah, it contributes to formation of part of the bladder and the urachus. So another point for Mahmoud. Mahmoud answered 3 questions, 3 audience questions. Okay. So let's do one more and then we call it a day. All right. So I would love whoever answered this question is going to get 2 gifts. Gifts of answering 2 questions. That's what I mean. So identify the structure and mention at least 2 arteries that supply it. So this is the abdominal organs. Olojede, is there any other person raising his hand? Olojede, continue.
This is the pancreas.
Okay. Mention 2 arteries that supply it.
The pancreatoduodenal artery.
Yeah,
and then the
arteries.
The celiac the superior mesenteric artery.
Well, the superior mesenteric artery gives rise to the inferior, anterior, and posterior inferior pancreaticoduodenal artery. So, are you going to go for another artery?
Okay, then the inferior pancreatoduodenal artery.
We've already mentioned pancreaticoduodenal. We've covered them all. I wish to say the pancreatic branches of the splenic artery. Anyways, another point for Olojide, 2 points actually. So he answered 1, and now he answered 1, which is 2. So 3 points. So I think this is all. We have come to the end of this session. Thank you very much to the participants. I hope you have sent your numbers into the chat box so that they will be noted, and then we are going to send gifts to them. Alamin, are you around, please? Alamin Usman. Alamin Usman. Digash.
I think he's around.
All right. So I hope he noted some of the numbers.
Is
So if you are a member of the audience and just share your number and your line or your network provider into the chat box so that we can, we are going to send airtime and maybe data to some of you. All right. So that brings us to the very end of this quiz. Once again, thank you very much all for participating. Thank you. I will also like to personally thank my friends, Ahmad Attahir, Aliyu Abdullahi, Al-Amin Usman, and Amir for assisting me in organizing the entire program. And special thanks to our guests, specifically Dr. Dauda E. Suleiman and Dr. Abdul Ibrahim, and also another thank to to Dauda Abdullahi for making it possible. This is something that he wants to make something that is annual, basically. So this is the second edition. Hopefully next year we are going to see another edition and continuously. So we are very grateful. And I'm recording this because I would like to share it with him. He's very much interested in attending, but due to some reasons, unfortunately, he couldn't. And even the last quiz, he couldn't attend because of those reasons. So thank you very much all. We really appreciate your presence and your inputs. And the results proper are going to be sent to the group. So I think we are going to call it a day. Okay. So let me just copy all the messages so that we'll have all the numbers. Okay, so bye. Thank you very much all.